All right, Chris, so what we're going to do is we're going to go over Chris's x-ray, that initial x-rays that we took, and then we're going to go over the re-x-rays that we recently did. Now, when Christopher came into the office, he was really just kind of hunched over and couldn't straighten out. He was like that for a while, and since high school, he's been having problems, and you know, here and there's good days, here and there's bad days. So, but it got really worse in the last couple of months, about 3-4 months ago. So when he first came in, here's the x-rays that we took. Here's the left side, here's the right side on the hip, and we see quite a bit of curvature right through here. On the lateral picture here, what we're looking at is on the back of these vertebrae, the curvature should be like a C-shaped curve, and you can see it's a pretty straight kind of a curve there. Not only that, but this bone here, the edge of this bone and edge of this bone, there's quite a distance in between, so there's quite a bit of slippage there, okay? When we look at this, this is his recent. Now, we still see a slight curve, but compared to before now, it's on the verge of like straightening out now, okay? You see that?
Yeah.
You see the difference? Okay. Now, on the side now, here's the vertebrae. There's more of a curvature there compared to here. He was straight and very straight. This one is curving quite a bit. The beautiful thing about this and how much improvement he's had, this space here, the edge of this bone and the edge of this bone here are is narrowed, which means that this joint is in more of a better position. This condition is called spondylolisthesis, and that really has improved, which is really fascinating. But at the same token, the curvature is in a better position, and that's what we're looking for. Okay? Any questions, Chris?
No.
Okay. So yeah, so this part here, see the difference here? If we were to measure that, let's measure that, okay? And see, roughly, if we were to measure, that's about 7 millimeters or so. And if we measure this, it's about 4 millimeters.
Oh, wow.
So yeah, it's gone down to 3 millimeters, so that's fantastic news right there. All right, any other questions or anything like that? So how do you feel? Tell me how you feel now.
I feel a lot better.
A lot better? Okay.
Lot better. I feel
What about your activities? Are you able to do work at home and no problem?
Yeah, I feel like I could do a lot more.
Okay. What about now? What are you doing for exercise right now? So let's talk about that.
Just light push-ups and pull-ups.
Push-ups, pull-ups.
Yeah,
What about
the stationary bike?
stationary bike? How many minutes are you doing that?
About 15 to 17 minutes.
Okay. The goal for Chris is that now that he's getting stronger and things like that, is to minimize the flare-up. So we're going the exercise route at a different level. Chris used to do handstands and all that stuff. He's a very avid gymnastic person. So, and he taught himself as well. So now he's going to be doing those things again, but we got to work on conditioning him for that. So we're at 15 to 17 minutes. Slowly it'll be at 20. Slowly it'll be at 30, and then get to a 40-minute. And then we're going to increase the workouts on push-ups, pull-ups, sit-ups, crunches, all of that stuff. And then essentially the spine will be supported much better, and we'll probably see more improvement in this as well. And it's going to hold steady. So at this point, what we're going to do is the active care for Chris is done. So now what we're going to do is what's called passive or wellness care, where he shows up every so often, so that we can keep the body in a healthier position. Okay? All right, buddy. Any questions or anything? Now, when Christopher came into our office, we had done initial x-rays as well, but we also did what's called an EMG test. So I'm going to go over the initial results and the present results right now. Chris is doing fantastic, but we're going to go over them. So I'm going to show you the pre and post here. So these are the results of 5/21/2010. So if you can see, the muscle activity wise, white is normal, green's muscles that are mildly spasming, blue's moderate, red and black are severe. So now at this point here, this is the new one, and if we look at that, now there's a little bit of signal still here. There's a red mark here and blue mark here, but rest of the area, it's all cleared up and the black mark is gone. And also Chris is doing fantastic symptom wise. Now somewhere down the road this will progress as well. Chris does have a condition called spondylolisthesis, But however, still with all of his other conditions too, he's still improving and progressing.